Hello, my name is Emily Buchy. I am a physician associate working in South Pembrokeshire Hospital as part of Who Are Thou University Health Board. Today I will be presenting a poster on the impact of introducing what matters to me meetings in a community hospital setting. As an introduction, we as an MDT desired a mechanism for improving inpatient communication with patients and their families. We decided on using the approach of what mattered to me discussions within our meetings. We decided on this as it is a patient-centered approach to discussing the comprehensive geriatric assessment, including rehabilitation needs of the patient, medication concerns, and even future care planning should they wish to, and then of course discharge planning as well. It is also a helpful tool to help the patients think about what matters most to them, including any personal goals that they wish to express. In terms of who is involved in these meetings, it would be the patients themselves, of course, their next of kin, and anyone that they would wish to be part of the discussion, and then medical team, nursing staff, and therapy teams. In terms of how we sought to implement this approach, the patients, after a few weeks of being transferred to the hospital, they were invited to a What Matters to Me meeting. The families were also invited. The patient and the family was given a leaflet a week or so before the meeting by the nursing staff, which just outlined the purpose and format of the meeting and allowed them time to think about what they would like to discuss, and then just explain certain terms in certain discussion points, such as future care planning, so that they would have time to look into what this involved. Within the leaflet, it also mentioned that the time slot would be 30 minutes to help prepare the family and patients in terms of the time restrictions. In terms of results, for the first 6 months after implementation of this approach, these outcomes were analysed. As you can see on the graph in the results section, in terms of the impact of what matters to me meetings and the outcomes, the average length of stay was reduced, discharges were increased, there were fewer number of deaths, 0 complaints, and reduced number of transfers to A&E. To add to this, falls and pressure sores were also reduced. In terms of feedback from relatives and patients themselves, this has been positive. To mention just one quote from a patient, the meeting was a two-way conversation where I could talk through my views. I think this nicely highlights the importance of what matters to me discussions and shows that it is a two-way conversation, like the patient says, and it allows them to express their wishes. In terms of staff feedback as well, nursing staff felt that there were less repeat conversations with families and less concerns were brought up that they felt were due to being able to discuss with multiple family members within one meeting. And then also staff reported keeping the meetings to a 30-minute time slot helped to continue with the intervention, as multiple meetings were able to be discussed in just one working day. In terms of recommendations from this study, this study highlights the importance of what matters to me conversations in patient-centered care. Furthermore, as a recommendation for future studies, 83 patients had meetings within our 6 months after implementation. We would aim to increase this number. Thank you for your time.